Probably the funnest thing about tennis elbow is that a majority of my patients who have tennis elbow don't actually play tennis. I'm actually one of the few people that had tennis elbow from tennis. My name is Jonathan Zalamea. I'm a primary care sports medicine doctor out of Cypress, Texas. What tennis elbow is where you have a pain on the outside portion of your elbow, and it's because all the muscles that allow you to go like this attach to that spot. And because of repetitive motions or other things, it can make it to where you end up having a lot of inflammation and pain on that portion of your elbow. I actually have a lot of folks who get tennis elbow from other sports. So any sports that involve you having to raise up your wrist can cause that discomfort. And a lot of the jobs that my patients have that require repetitive motions can cause the discomfort. So for example, mail workers or other types of shipping companies, they end up having to do this motion a lot and can cause that discomfort on the outside portion of their elbow. If you notice on a day-to-day basis that you're required to do certain motions like this with your work or whatever you have to do on a day-to-day basis, it can cause you to be at risk for tennis elbow. Also, if you notice that you're having to lift up heavy objects with your job or with your sport, it can make it to where you're at risk for tennis elbow. And then of course, if you're only doing those things and not cross-training with weight exercises or stretching exercises, it can make it to where you're at higher risk for tennis elbow. There are a few ways on how you can prevent tennis elbow. The three main things that I tell patients is that number one, whenever you notice that you're starting to have some discomfort in your elbow, that you back off on the activity and reflect on what you've been doing that may be leading you to have that discomfort. Number two is making sure that you adequately stretch beforehand. If you stretch the muscles throughout your wrist during an activity that may predispose you to have tennis elbow, by stretching, you can lessen the amount of strain at the elbow. And then number three, I recommend for some of my patients to use a brace, a tennis elbow brace. That tennis elbow brace helps counteract the forces that come from your wrist that go up to your elbow. If you're using the brace incorrectly, it can actually make things worse. So usually I'd wait till you see a doctor before you start that type of treatment. So the treatment for tennis elbow, because it's an overuse issue, really relies on three different tenets. Number one, whenever I talk about inflammation, I talk about taking medication in order to help reduce inflammation or using something topically to help reduce inflammation. Sometimes, occasionally, we actually have to do an injection to help reduce inflammation, but we try not to do that if we can avoid it. Number two is something to help prevent this from happening again. Stretching those muscles beforehand will be helpful. I usually give my patients a set of exercises to work on that, or ask them to work with physical therapy on that. And then number three, not irritating in the first place. Whenever it comes to irritation of tennis elbow, it could be secondary to repetitive movements like this. So if I ask my patients to flip over their hand and raise up like this, it usually can help offload that area. Looking at various parts of their life and seeing what they're doing that may cause a discomfort may be helpful. And then really kind of nailing down ergonomics whenever it comes to work situations can be helpful.